Good day, everyone. This is Sidney Lucero, and I'm going to talk about the developmental aspects of the respiratory system. In the starting point of the respiratory system begins with the fetus. In a mother's womb, the respiratory system is the lungs are filled with fluid and all respiratory exchanges are made by the placenta. At birth, this fluid is drained and the passageways is filled with air. In birth, the alveoli is inflated and it begins to function in gas exchange. But the lungs isn't fully inflated for 2 weeks. If the surfactant is present, this change of the respiration is successful. Surfactant is a fatty molecule made by cuboidal alveolar cells. It lowers surface tension at the air-liquid interface and thus preventing alveolar collapse at end expiration. Here's an homeostatic imbalance in the respiratory system in infants. The infant respiratory distress syndrome, or IRDS, where surfactant production is inadequate, or in infants that is born prematurely. These infants have dyspnea or having trouble breathing. They use a huge amount of energy in inflating their alveoli that collapse after each breath. Although many infants is suffering from this syndrome, causing their deaths, many also survive now because of the equipment that supplies a positive pressure continuously and keeps the alveoli open and working in gas exchange until the lungs produce adequate amount of surfactant. Another homeostatic imbalance for the respiratory system is the cystic fibrosis, or the CF. It is a genetic disease or an inherited disorder that causes damage to the lungs. It oversecretes a thick mucus and it clogs the respiratory passages and puts a child at risk for fatal respiratory infections. It also affects other secretory process, impairs food digestion by clogging ducts that deliver pancreatic enzymes and bile to the small intestine. It also affects the production of sweat glands into an extremely salty perspiration. In people with mutated gene, CFTR gets stuck in the endoplasmic reticulum. CFTR is from the heart of the CF. It works as a chloride channel to control the flow of chloride into and out of the cell. The respiratory rate is highest in a newborn infants, about 40 to 80 respirations per minute. In infants, it is around 30 per minute. At 5 years, it is around 25 per minute. And in adults, it is 12 to 18 per minute, but increases again in old age. In childhood, the lungs continue to mature throughout childhood, and during this maturing, more alveoli is formed until young adulthood. But in smokers who began smoking in early teens, the additional alveoli are lost and the lungs don't complete its maturing. Another homeostatic imbalance in the respiratory system is sudden infant death syndrome, or SIDS, also known as crib death. This happens in infants who are healthy that die in their sleep because they stop breathing. This is believed to happen because of the problem of neural control of respiration. This occurs in infants with prone position. Respiratory diseases include asthma, caused by chronically inflamed hypersensitive bronchial passages that responds to many irritants. Another disease is tuberculosis and pneumonia that is experienced in many people. Antibiotics lessen their threat in people. The present and most damaging disease is the COPD, or the chronic obstructive pulmonary disease, that causes airflow blockage and breathing related problems. The last respiratory diseases is the lung cancer. In old age, the chest usually becomes more rigid and the lungs begin to lose its elasticity, which decreases the ability to ventilate. Its blood oxygen levels decrease and the sensitivity to the stimulating effects of carbon dioxide decreases. As a result, many old people exhibit sleep apnea, which is the sleeping disorder. In addition, when we age, the protective mechanism of the respiratory system becomes less efficient. As a result, old age is more at risk for respiratory tract infections, particularly pneumonia and influenza. That would be all for the developmental aspects of the respiratory system, and thank you for listening.